Hi, I'm Dr. Julie Steinauer. Let's talk about how vision and ADHD can be related if there's a problem. Now, before I go into that, let's talk about how you can connect with me. If you're local, give us a call at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. You can do one of two things. Either click on the Schedule a Consultation button, which means that you've probably watched me for a while and maybe you're just ready to take the leap and do something about these visual issues that you're concerned about. Or if you're not so ready and you're wanting to toe step into this a little bit lighter, then I would say click on the button that allows you to fill out a questionnaire, and we will be emailing back and forth with you to talk about how we can help you. Now let's go back and talk about how vision and ADHD can be linked or associated with one another. So sometimes in the diagnosis of ADHD, we can diagnose it and then potentially be missing a visual component. If children look like they have ADHD but there's actually a visual component, it can be a visual processing disorder, or it can be something that's more commonly diagnosed, which is called convergence insufficiency. Now, this actually exists in about 90% of patients who are diagnosed with ADHD. That's a really high volume of kids that are diagnosed as ADHD. And possibly it's just something going on with their vision. Now, I'm not saying there are no cases of ADHD, so everybody simmer down. But what I am saying is that there is a very high instance of this convergence insufficiency in children who have been diagnosed as ADHD, whether that's wrongly diagnosed or not. Now, what do we do about the convergence insufficiency? What does it mean? What's it about? How do we fix it? Well, what it means is that whenever they're going to look at something up close, like with reading or doing schoolwork, their two eyes don't line up or cross in accurately together as a team. This can be a problem. It can mean that they're not lining up the images, so they might be seeing a double image that's kind of superimposed like this. It could be split apart, or it could be wiggling back and forth like this, to where they're noticing that things are moving around and they're having a tough time staying focused on the print. They may even say that the words wiggle and move around on them when they're trying to stay focused. Now, why is that a problem? Well, if you were experiencing that, you might not like to read either. And so it can cause problems with focus, attention, sitting still, wanting to read, wanting to do anything near work that could be like reading or homework or paper involved. But they may still love to do something like sit down and play with puzzles, or sit down and play a game, or watch TV or play video games. So if their attention span is good enough for those things, then we maybe do want to wonder, is it really ADHD? If they can't sit still for even like playing video games or watching TV or doing something that they really love, we definitely think, well, maybe this is for sure a case of ADHD where they can't stay focused no matter what, even if they wanted to. But in cases where, again, we're like, vision or ADHD, if this convergence insufficiency exists and we treat it using syntonics, which we discuss in here quite a lot with our filters that we use, and also vision therapy, which is kind of more of a mechanical or motor type of component where we're training the brain and eyes to work together. You know, if we're able to use those two things and we're able to correct the convergence insufficiency, does the symptoms completely go away of ADHD? If it does, we correct it with the visual problem. If it doesn't, that's okay. They can continue to maybe go the course of something holistic and natural as far as supplementation, or even medication if that's needed. But our goal would be, if it is something visually related, which again, this convergence insufficiency, or sometimes just called CI, is something that we find in 90% of ADHD kids and adults. So it's worth looking into, because if we can correct that, and maybe they don't need to be on medications, or maybe it changes everything and it's more manageable, then obviously that's worthwhile to do. Now, it is, again, two components of correcting this. Excuse me, both the syntonics component and the motor type of component of teaching the brain how to use the two eyes together better as a team, to line up, track, and work in unison so we don't have that double or that moving image. Now, not all kids who have convergence insufficiency will have double vision, so it's not something that is consistent across the board with everyone. So after correcting both the, again, using like the syntonics and the more motor type of component to correct and use the two eyes together as a team with the brain, then if we've got a reduced amount of symptoms, that's fantastic. That's what we were looking for. Now, if you like this video, you can hit that like button. If you haven't done so already, subscribe to our YouTube channel. Hit the all icon on that little bell. That way you're subscribed to all of our videos. If you think this is worthy, pass it along to someone else who could benefit from it. Thank you.